Today's guest is Dmitry Karpov, co-founder of WorkDone, a healthcare technology company that's rethinking one of the biggest pain points in medicine, documentation. Dmitry's journey is a fascinating one, starting with selling trading cards in his hometown in Russia to building companies in robotic process automation and now tackling compliance and patient safety in one of the most complex industries in the world. In this episode, we dig into his path through Y Combinator, the lessons he's learned about building in healthcare, and why accurate medical records can literally be a matter of life and death. We also explore how AI and automation can free up doctors and nurses from repetitive tasks, allowing them to focus more on care and less on paperwork. This is a great one for anyone interested in entrepreneurship, healthcare innovation, or the future of AI in medicine. Let's jump in. Dimitri, welcome to Peaking. How you doing today?
Great. Thank you for inviting.
Absolutely. Super excited to talk with you about WorkDone. It seems like an exciting venture that you've been in for just under a year now. This is not your first run in entrepreneurship. You were a co-founder of Electro-Nik for 4 years. Interested in learning a little bit more about that. And then also worked at the Big Four, worked at EY, and transitioned out to be a co-founder. So excited to talk about that journey as well. Starting at the beginning, did you always know that you wanted to be an entrepreneur and start a company?
My first business I built outside of high school. I was selling trading cards like Magic the Gathering in my small hometown back in Russia. And that was a big success. School kids were bringing their lunch money to me. And to a certain degree, the venture I ran could be compared to a small drug cartel where you build international supply line. Because think in case of MTG, it's legal. You just buy cards on eBay. They get delivered to your hometown where people only heard about the Magic. No one touched the cards ever because they're not sold in Russia at the time. And then it all starts because it became pretty big for my age, I think. At least
Awesome.
I never needed pocket money after I started that.
Yeah, absolutely. I did the same thing with candy. So I would buy candy at the store, 25 cents a piece, sell them for $1, and you kind of build a business. It works. So you actually had international supply. You were shipping in cards and then reselling them to your friends and the classmates?
Yeah, pretty much I've learned about eBay earlier than they did.
Yep, that's how it goes. That's great. Have you watched that film about Tetris, or do you know anything about Tetris?
I played Tetris a lot. I watched the movie. Yeah.
Yeah, there's a recent film that came out with kind of the story of Tetris and how getting it out of the Soviet Union was just such a wild story. Very much recommend that. It's with
I'm much younger than that guy, quite honest. So my story to get it in the States was easier. Just apply to the grad school and take exams.
awesome.
And
Did you know that you wanted to leave Russia for the United States, or that just kind of happened, or how did you end up kind of deciding to move across the world?
plan on going to grad school to the United States was pretty much solid since high school. I am not the first family member who did it. So I was following the traces of my older siblings, and most of them studied in grad schools abroad. But then desire to stay here came after I started my first venture. The real business was social media marketing agency, which we sold when I was just 20. Sorry, I was 23 at that time. And then I decided to stay and to dive deeper into big enterprise, actually.
Awesome. Yeah. Wow. Incredible. What did, so it was an agency that you sold the first time around?
It was agency, but I was responsible for algorithmic search of data in social media when search engines there didn't exist. We solved questions like trying to understand the total brand impact and impressions from a campaign that could be viral, for instance. You hire someone, an influencer, they do a campaign. It's really hard to measure. It's really hard to measure sentiment, and you can do that manually until you reach certain scale. But big brands, they require more automation there, and that's where I first time kind of applied things I learned in physics and in mathematics to real business setting.
Incredible. Wow. At 23, man, some people just figure it out fast. Very impressive. How's the venture environment in Russia? Are you familiar?
Not that much. I've never actually worked full time or never built business in Russia. I think it's wild I'm not sure how it changed over the last 10 years, but at the same time, that's a land grab opportunity for many smart people.
Yeah. Are you ever considering going back?
When we built our previous venture, Electro-Nik Robotics, we were kind of building R&D outside of Russia, so out of Russia, sorry. And that's partially stepped back a lot of talented programmers, ability to access all this talent, hire top of the top, build big R&D office there. It all comes with the cost, and the cost was pretty much we needed to relocate after 2022.
Got it. Yeah, I used to recruit for a startup in Munich, and I would recruit Russians fairly often. There was a great talent pool coming out of Moscow and a few other colleges as well. I was recruiting for a data consulting startup and kind of helped with Daimler and other big car companies in Germany. But let's talk briefly about Electro-Nik. So AI-powered robotic process automation and document processing made easy to use. You worked on that for 4 years. What's the short story there?
Robotic process automation is a type of automation when you automate on the level of graphic user interface. It allows you to automate repetitive work like copy pasting between spreadsheet and very old legacy web form in any environment. If you have instruction for the work that is pretty discrete, which is easy to read for a machine, it's rule-based, then you can transform it into a virtual robot sitting at a virtual machine somewhere in the world and essentially taking control of our keyboard and mouse in a very simple way to explain it. And we didn't invent this technology, but we came up with the idea of how to make it affordable for small businesses by building a tool for system integrators who serve these SMBs so they can build JavaScript-based workflows, turn them into RPA workflows, and doing so automate work that is repetitive in segments like government, healthcare, insurance, and others where there's a lot of repetitive paperwork. Document processing is a thing that came later. It's the ability to extract data from PDF, for instance, or from a scan, and then to process this data with RPA workflows. So we built this company. We started in 2019. We went to Y Combinator in 2020. Scaled the company to Series A very quickly, and since 2021, leave without any external financing. It operates now in 50 countries, more than that, so it's pretty big team. We started that out of Austin, Texas. We moved there from San Francisco during COVID, and I left the operating role in 2024 to focus on WorkDone.
On to the next. Build a successful one and try again. What keeps you? What keeps the fire going? I mean, most people don't get to sell 2 companies before they're 30 years old. How do you do
I
it?
mean, I'm mostly 40 in this moment, so
Even before 40. I mean, you're 2 for 2 at least for those 2 companies.
the desire of building WorkDone came from the point that all the cases of automation I worked on for 10 years were about saving time and money. And in healthcare, you can actually turn compliance into better patient outcomes and better health, better quality of care. And for me, it's a personal challenge of building a product that does something like this. It's incredible fulfillment compared to the situation when you just help people to cut 30 minutes on data entry. So that's a challenge, very interesting one.
Yeah, absolutely. It seems like it would be very motivating. Are you spending any time in clinics and hospitals with the end user?
I do, and my co-founders do as well. So it's very important to observe. First of all, we are not from medical field in the first place. So we spent a lot of time there before we started WorkDone. And once we started onboarding clients, and some of them are hospitals now, like it's great to be there because the reality of operating on the hospital floor is very different from what most patients can think about this. Even if you've been to a hospital and stayed there for many days, there's so many things going behind the scene there that you must be there if you build it.
How did you get in without a product in the first place? Is there a hospital in Silicon Valley that just allows people to come in to understand the environment better?
Not exactly, but there are first of all, many health systems would have innovation teams that, similar to my former role at UI, are in charge for scouting for new technologies to bring them to the infrastructure and to the suite of tools. we were able to do the prototype without being inside a hospital, but as soon as we build it, we started to show it to those people who actually are responsible for quality of care, compliance, for financial outcomes in clinics and hospitals. And then I truly enjoy going there inside the building, which I think next time for me will happen in 5 days. I will be in 1,000 plus physicians hospital here in Nevada, and that will be a cool day. Can't wait.
Are you living in Nevada, or that's just the hospital that's using your product?
Both. I live between San Francisco and Nevada. I live near Lake Tahoe. We bought a ranch here to raise family back in 2022. Before that, I was living in Mission Bay, San Francisco for many years, and New York for even more years, around a dozen years together. And that's different from these major like metro areas. But at the same time, it's still, to me, part of Silicon Valley. It's just longer ride than from East Bay. So it's kind of the farthest bay of Silicon Valley. With me in mind, where are you based?
I'm actually grew up in my career in Silicon Valley. So I spent about 6 years in Silicon Valley. I'm now in Denver, Colorado. So I had the same yearning for the outdoors that sounds like you were looking for. I also want my ranch, but I need to sell 2 companies first. And so I'm working on that aspect. But yeah, I'm in Colorado now. My business partner is in Portland, but most of our work is with startups and companies in San Francisco and New York, because that's where the industry is. But recruitment is so, call based that you don't need a ton of on-site time. And so we'll fly out for client meetings here and there, but for the most part, yeah, we're happy to be out of California's cost of living bubble. It's just so crazy what you have to spend to live in California. Although it is an amazing state, it has everything. There's like almost no state that has something that California doesn't. You can really do it all. The skiing's not quite as good as Colorado, probably not even close to as good, but you can still do it. It's still there. Lake Tahoe is pretty awesome. Lake Tahoe is actually one of my favorite places in the world, so I'm a little jealous. I think I would like a property there as well. So how did you decide to get into hospital tech or clinic tech? You obviously had the experience with document processing and documentation, but how did you decide your domain?
Before starting Electro-Nik, I spent 6 years with EY, 3 of them in Palo Alto, and we automated a lot of compliance and internal audit tasks. So if you look at all volume of tasks, before Gen AI, you were limited to maybe 5% of work, because most of compliance across different industries require looking at unstructured data, from documents to patient records, to drawings in construction. And I was looking into industries where compliance is not just check mark, maybe even important check mark, but where good compliance means great business results, where you can sell compliance as a revenue driver rather than cost driver, cost center. Plus, as I mentioned before, a big consideration was what's the real effect beyond the automation and saving time. And hospitals came in handy. In the past, my software from Electro-Nik was used in many US healthcare systems. So we have experience, and I have personal experience of selling to healthcare providers. But the real decision point was made when we left a meeting with top executives of big insurance company. It was one of the industries we looked at, and we've learned from them that they have literally army of people, data scientists, building tools to automatically process insurance claims, which, if you look at this in a different way, means looking for something not to approve the claim. If claim is compliant, you approve that. If not, you deny it. And we thought, okay, if these guys have thousands of people now, I can imagine that maybe some healthcare providers do have this army as well. But what about the whole industry? What about community health centers? What about small clinics? What about big systems? The time when we started, we didn't realize how big the demand will be from bigger hospitals for this solution. So we originally thought like we probably will go to smaller side. Now, just 5 months into this journey, we are much more convinced that we are a solution for big health systems who struggle a lot with quality of care and regulatory compliance. But when we started, the idea was pretty much to build on the side of good, not the insurance side, and to help smaller providers make sure that their medical claims are always approved.
What does a Russian think of the American healthcare system?
Let's say that before 2022, for any major things I needed to do with my health, I went to Moscow. So just surprisingly, even you can think like Russia apparently is a cheaper country, so you can buy more on your dollar. But it always surprised me that in healthcare, a lot of costs are about equipment, and equipment there is sometimes better than I've seen in the States, in like in dental space and in more like this kind of consumer health things. And I thought like, okay, if you buy German equipment, why the cost is 10x different between New York and Moscow for the same thing performed on the same equipment. Apparently labor cost, but arbitrage is not 10x, it's maybe like 3x. There's something there, something in US healthcare system that makes everything much more expensive. I mean, I participated in changing the industry, which I'm very proud. And I think that a lot of things that we address, like what our software helps to address for hospitals, it should help them to be more profitable, which means potentially in a competitive environment, it means for them to be more affordable.
Yeah, absolutely. How competitive is this space? Are you competing with any enormous companies trying to do the same thing? Is it mostly startups competing in this space?
It's both. I think in all industries now, that's a big question, like who wins the AI race, established players, whether newcomers. The space is very hard, apparently, to work with, like applying AI to real patient data. I would emphasize the word real here is very different from building an MVP that operates with synthetic data. And in this space, you need to build high quality, very safe, very like audit trail ready, explainable things. Otherwise, no one will let you plug your solution into patient charts.
Have you had any disaster scenarios yet? Anything that you've learned from and improved upon?
I'm not in the security or privacy space. And apparently, like to start working on patient data, you need to be HIPAA compliant, which requires you implementing certain protocols inside your product, from architecture to the way you process data, store data. Overall, there's SOC 2 compliance again, but without that, you cannot really sell to clinics or hospitals. So by the moment you're ready to plug something into electronic medical records, you're kind of secure from privacy and from overall security perspective. But of course, a lot of learnings once you start process the data, how you interpret that, how you optimize, what are you looking for, how you can, like in my business specifically, the major problem is how you process big volumes of data through a lot of different rules. For instance, if you live in the States, you can go to MyChart app or many other apps that allow you to see your medical records from doctor encounters. You can go there and try to download PDFs for a year. And let's say you had 3 medical visits along the year, it's 50 pages of PDFs. So think about your history. Let's say you were in the same hospital for 5 years. So we're talking at least about 150 pages of medical records. Plus, if you go full suite, around 5,000 rules to scan them against. And you want to do this efficiently enough to be able to deliver a commercially viable solution that has some margin embedded into that, not just burning money to address this question. And that's where a lot of learnings come on, how you build this to work effectively. When we also started, we were connecting to medical records on a daily basis, because there's nothing, like in our first clients, there was nothing time sensitive to do the scan every hour. But now, as we work with hospitals, they monitor what's called sepsis bundle matters compliance or stroke bundle matters compliance. These things require you to check records every few minutes because you try to adhere to standards when many things are being delivered within 1 hour from either sepsis diagnosis or from a stroke. And that, again, a lot of infrastructure tasks.
So what is the end use case here? Is it in the kind of insurance department, or are the actual practitioners using your product as well?
So let's unpack what WorkDone is AI audit of medical records. We can say as simple as that. Who would need that audit? And we can split stakeholders roughly in three parts. Those people who are in charge for quality of care, because medical documentation reflects the workflow performed on a patient. So you observe the care through medical records. There is no other way to do that. So anyone who is about, I want to have less readmissions in the hospital. I want patients with the same conditions have shorter hospital stay. Not from financial perspective, but like we want to get you well quicker. Very like medical practitioners, clinicians, motivated actions. So those people, we usually sit in quality, they report to chief medical officer, and they do a lot of work today of monitoring if there is a certain condition, we apply all the prescribed playbook roughly for those of you who are outside of medicine. And there are teams who work more on like an intersection of the data and finance. These things in US healthcare system are called coding teams or clinical documentation integrity teams. Those teams, after you encounter any care with the hospital, work on your medical records on the exact wording there. They don't actually work themselves. They work with doctors who created these medical records, who can create addendums to that. They work with them to make sure that this language will maximize financial benefit of patients and hospitals. Like that you have the right information to support a diagnosis that is based for billing and so on. So they are an intersection. And then there are compliance teams whose role is to make sure that the hospital adheres to high standards of patient care. And these standards can come from many regulatory bodies. One of the probably most important players for hospitals in this field will be the Joint Commission. That's when a group of doctors, peers, come to your hospital every 3 to 5 years, actually 1 to 5 years. They open medical records of recently discharged patients and start to read them very carefully to again observe the clinical workflow to make sure that you are not missing something. And this is purely, let's say, a regulatory driven activity. There are audit teams. There could be involvement of quality teams and coding teams in this work, but their major role is to make sure that hospital is ranked high on different ratings that include looking at patient quality of care, make sure that there are no penalties from CMS, from Medicaid payments, and so on. So these three stakeholders, they all benefit from audited medical records. Those who benefit the most will be those who need this information quicker, those on the clinical side. Because again, if you're diagnosed with sepsis, there should be a lot of actions performed, from blood draws to administering drugs. And they all should be performed in certain sequence very quickly. And you cannot do this manually. Like you need an army of people to monitor all these things manually. And the only one way is to automate.
Incredible. You have active customers, people using this product actively, and you're just continuing to build out features or improve the models or just sell. What's the current plan of action for WorkDone?
So there are clinics and hospitals now who are clients. And what we do most of the time, except of like heavy R&D on how we optimize everything, is we add in new rules for new specialties, for new use cases, from new regulations. And we learned a lot that even while regulatory environment is the same for all hospitals, they all have a bit different problems, like some type of missing information. For instance, we work with one of the hospitals when there is what's called 12-point assessment form is always, not always, but often incomplete or is missing. What's 12-point assessment? It's a small questionnaire you complete or a physician completes with you when you are admitted to hospital, like intake form pretty much. It says, how you feel today? Are you vomiting? And so on. And just looking for completeness of this form and timelessness of appearance when the patient is taken into the hospital is important for them. Our core feature that we now also focus on is the ability to add custom rules without any engineering. Like I want to make sure that all patients upon admission of our hospital within 1 hour have this form attached. If not, I want to notify a physician to essentially attach the form while the patient is still there. And these type of scenarios are very common now among our users. So that's also where we work on the innovation.
Taking a step back, sounds like you're second time YC founder now. Is that correct?
That's correct. Second time we see alumni at this moment.
So what about the first time made you excited to come back?
It's a great place to build from scratch. I think those founders who will win the most from YC are those who have solid idea, commitment, like focused on big problem, have solid idea how to address it. And they are coming from backgrounds where it's not hard for them to test this idea, but they don't have anything else. Maybe work in prototype. Prototype would be actually very good, but traction very small, essentially maybe one client, maybe no clients. And that kind of absence of traction gives you a lot of flexibility to go left and right, which makes you more receptive to advices from group partners who are experienced entrepreneurs themselves, typically with exits. That gives you a lot of advantage. You essentially get one of the best advisors in building startups, aligned with you, working with you, investing in you. And then at the end of the program, you have a chance to poke the world for funding. But now is different. There's also YC launch when Y Combinator puts information about your product or your company on social media, and then gives a lot of inbound interest that didn't exist in 2020 when I was there for the first time. And also, like, I really wanted demo day because my batch in winter 20 finished with COVID, with lockdown. So we never had a real demo day then. So in 5 years, we finally got it.
Awesome. I had to come back for that. What made you interested in taking funding as opposed to bootstrapping? Is the infrastructure cost, startup cost just too high?
This time we are much more lean on funding compared to building the previous time. But still, I think that it's good to share risks with and partner with people. All folks on my capital table are very, very useful in terms of the introductions and advice they can give. Actually, the majority of them are YC alumni as well, who now run funds or health tech companies. So I see fundraising not only as a way to cover the payroll for the company, but also to align and increase your footprint in the industry where maybe you don't have some background.
And bringing in customers for you as well, or connections at least.
Yeah, I think bringing customers would be something that a lot of people promise, but it never happens. And that's fine. You should not expect anyone to bring you a customer, but helping you to connect with people who otherwise would not talk to you, to validate your hypothesis about these people having needs, and maybe some of them in this validation process will convert into your customers, is always great. But in general, it's more like a network rather than customers.
Yeah, that makes sense. Yeah, it's a pretty tight network, the YC world. It seems like a lot of the YC companies are customers of the other YC companies, and it's like
not my case, unfortunately. I think it's so great to build something for either building and running a company or for developing when there's so many potential customers in your batch in YC network. We had great batch mates who do SOC 2 compliance, open source SOC 2 compliance, and I think that 30% of the batch were their clients, or at least signed up for them in the wait list, because everybody needs SOC 2 compliance outside of YC. So it's great. Not the case for the medical field. So we had very successful launch on Hacker News. We got one very big US system inbound from that launch, and everybody was very skeptical, saying like, hospitals don't treat Hacker News. Like, why would you make any investment in that betting for the return? But maybe like hospital CEOs do not, but they do have technical teams, innovation teams. They want to stay up to date with what startups do. They read Hacker News, and then suddenly there are so many people who work in IT for hospitals who can comment their upvote, share their challenges, tell about challenges of their family members who are doctors, and so on. So we had very great launch and counterintuitive to the expectations, and brought us customers.
Who was the skeptic? Who was setting low expectations for the Hacker News article?
Even our YC partners, like their take will be similar. Like if you build something that those people who are majority audience of Hacker News can go and touch and they use maybe in their work, register for, it's very different from the post where you say, that's what I'm working on. That's a video demo. If you know anyone who may be interested in talking from hospital side, please connect us. Very different call to action.
Yeah. I'm very familiar with the frustrations of working across hospitals, working with a ton of doctors, a family member that is just in and out of the hospital with a difficult condition. And it's so frustrating. You'll go to all these doctors and you have to tell the same story. They have all your files, but they don't go through it. Or you'll go through something that is supposed to be approved, and the insurance will come back and say, yeah, this is not approved, and you gotta fight it, and you gotta talk with the doctors, and it just is really a system that can use improvement. And yeah, I'm really excited to see innovation in the space because it just seems so necessary.
Speaking of which, you will be able to do that very soon, because on our journey, we found that there's great value for people to remove any mistakes from their medical records. And why would mistakes be there in your record or in mine? So many reasons. There's also even government guide on how to find mistakes in your medical records. And the very simple example, if doctor copy pasted from other patient encounter, which a lot of physicians do, it's actually one of the major sources of mistakes for medical records is copy pasting between different patients, because our conditions may be similar. So you can save a lot of time by copying from my record to yours. But what
Whoa.
if I'm smoking and you're not? And that smoking will make it to your record. And then you will go and apply for life insurance, and they will pull these records because you will give them that right when you apply for life insurance. And they will see that you're smoking and give you a higher rate. And you will overpay thousands and thousands of dollars over your lifetime for that higher premium for life insurance. And this is a simple example of money, but if you are taking a medication that doctor who prescribed it to you were not able to review all your medical conditions in the past because you came to a new physician for annual checkup, and you have this tall medical records, all human being would be able to go through all of them in the time given. And then what if your current medication is conflicting with something that was revealed in your early condition back in the past? Maybe you're taking a medication that combined with your previous condition will lead to an allergy to grapefruits, for instance. You will eat a grapefruit and arrive in ER or something like this. There's potentially a lot of conflicting information between medications and conditions there. So we decided that we should put the product in some version, which we call patient version, just online for free. So anyone can go there, upload their medical records, and see all list of concerns that we found there from clinical, from regulatory, and other standpoints.
Do you find that to be used? Are people doing that?
So we haven't released the product yet. That's a plan for the August, but I'm more than sure that we will have an audience. Maybe not so many patients in the first place in the beginning, but lawyers want this thing a lot because we partner now with a couple of lawyers who do patient advocates, essentially, in cases when insurance companies deny something and they need to stand with the patient to figure out what's the weakest point in this denial. Like maybe doctor wasn't qualified enough to be on a peer review, like family doctor providing peer review for heart surgery pre-authorization or something like this. And they're looking for these mistakes all the time. And they're the major users of this government guide of what to find. And definitely will be a lot of interest from doctors who would like to check their what's called pre-bill before you submit a claim. You want to find all the reasons for why it should be denied. Conflicting date of birth. It doesn't mean like if you have conflicting date of birth in your medical record that the hospital or you would not be reimbursed. It likely will be reimbursed much later. You may go to expensive appeal process and so on. So it's many motivation for anyone who is involved in overall healthcare system to make sure that they operate with clean medical records, because any mistakes or conflict there potentially cause friction in any of those sides. Like why, for instance, 12-point assessments are very important for a hospital. Major reason for patient lawsuits or inpatient facilities will be an acquired condition. I went to hospital with flu. Unfortunately, I got something more serious there. And then the whole case will be, did you have that condition before or not? Or you acquired it in a hospital stay? And if you're missing the key document that assesses your condition when you're admitted to a hospital, then it's hard for a provider to stand on their grounds. It's easier for the patient to say, hey guys, this quality of service there wasn't there, like quality of care wasn't there, and because of that, I'm winning the lawsuit. If you just Google patient lawsuit one and add more documentation, there's a whole new world. $55 billion in awarded lawsuits in the States every year.
Every year?
55 billion.
Wow. We've never been anywhere close to a loss.
And just guess who eats all these costs, and us patients, essentially. Surprisingly, right? Some patients win,
Costco.
but providers need to get this money from somewhere. They operate in tiny margins typically, and that makes us patients to pay for increased premiums, essentially.
How do they do in Russia?
I think the private sector there is, quite frankly, I don't know. I have very few relatives who live there, and I've heard that private sector is pretty big in healthcare, and people like it in general who use that. Probably private sector should have similar problems to the problems of U.S. private healthcare system.
I think the U.S. litigation environment is about as aggressive as it gets. I don't know if there's as many lawsuits in any other company, or just like everybody's trying to sue everybody for anything. I heard of my grandma was a attorney for State Farm, so she tried to verify claims and fight people that are coming in. So maybe she was one of the bad guys. I'm not sure. I think she was one of the good people. But there's a term called vexatious litigant, which is just someone that just sues for anything and everything as often as they can.
That could be another avenue for people using the patient version of the product if they want to sue the hospital and they want to find grounds for that.
Yeah, no kidding. Awesome. Well, super excited to see the product, especially the patient side. I definitely will download it once released. I'll follow that journey. You're only 8 months in. It seems like you've accomplished so much. How are you moving so quickly?
I think overall, there's a superpower of moving quickly among entrepreneurs now, given the ability to use AI for different tasks. It makes you moving much faster, not only in creating code, but in all aspects, from marketing to sales. I recently thought about our previous YC startup at the same point of time, how big the team was, how big our revenue was, and compared it to current situation, and realized that we are doing on par pretty much, having twice less people.
Accomplishing the same amount. Incredible. What does the future look like for you? What do the next 8 months look like?
Acquiring more hospitals, helping hospitals to pass through regulatory audit cycles, which doesn't happen every year, building cases there, catching more and more mistakes that are what's called patient safety risk. For instance, you admitted to hospital after a car accident, and note from the first person who talked to you from a nurse says pain in left shoulder, then note from a doctor who talked to you later says pain in the right shoulder. We need to figure it out. Like, this conflict creates a lot of risks down the road. We need to figure it out. And each time patient safety risk mistake is found or issue is found, I feel incredibly proud for what we're doing. And I'm also thinking about maybe we should have a counter, maybe even public counter. Overall mistakes found by this moment, these are like tens, thousands, dozens, thousands. And then patient safety risks, because each time there's that red light turning on, I feel that our software makes someone's life potentially better.
That's incredible. Yeah, I think that's a good idea. It will help you with your pitch as well. What is your pitch? You're going into a hospital system. How do you sell WorkDone?
It depends whom we talk to, but if you are a chief medical officer, we will tell you that we will make sure that those things that are important for quality, we will establish oversight on steroids over that. Our quality teams will be on top of every patient record, every action performed for the patient. And they would be able to focus on solving the issues into physicians, figuring out why something is systemic, maybe lack of training or things like that, rather than on manual review of information and manual routine communication, like sending email to someone saying they need to submit this documentation within the next 12 hours. Otherwise, they would not meet quality standard, or they would not get paid, or things like that, or something needs to be addressed within the next hour because patient safety risk matter.
And what's the return on investment for them if you don't quantify, a lawsuit that could result? Is there a immediate return on investment without thinking about lawsuits?
We quantify in a couple of different measures. So you can quantify based on just purely financial impact from better billing. Because better documentation, think about this. You create documentation, then something happens, and in the end, this documentation makes it to insurance company. And insurance company now 100% will use AI to look through everything. So where is this point in the life cycle of documentation when you as a provider or as a patient look at everything? And if this point is closer to the point of care, then you can prevent more and more situations when it's too late. Mistake in documentation not only means fixing that, it also means doing that in a timeline that shows that this is small mistake of missing documentation rather than quality of care mistake. For instance, we do have many clients in what's called SUD, rehabilitation space, substance use disorder. That's essentially where people with drug addiction are recovering, and they need to be asked many times a day on how bad they feel today. It's called PHQ-9 questionnaire, and the score in this questionnaire indicates whether you have depression or not. If this score is missing, like this score is important for the type of treatment you receive there. There should be dynamic to the score to demonstrate that you're feeling better. And this score is often missing in documentation because the volume of this, the need for the scores for the, like how many times you need to answer these questions is huge. It's very regulated business. And if you find this mistake 2 days after you were supposed to have it in medical records, then it's too late to come and say, and ask patient, how did you feel on Monday morning? It doesn't work this way. And if that happens too late, then the insurance company would not pay for this patient in full. They would say, you're supposed to treat the patient based on how bad they feel today, based on PHQ-9 score. Look outside of 20 score records, 3 were missing the quantitative information, which means we're not sure what you based the treatment on. So we don't pay for the services for the care when it doesn't adhere to standards of care and behavioral health. And that's the major thing we can quantify, like how many preventable mistakes that improve the billing we can put in there. And then depending on hospital goals, if we talk about quality of care, if we talk about the impact on US News Ranking report, which surprisingly also looks in medical records, journalists open medical records to find like how well you document allergies, for instance. Win in top 10 is big financial impact for a hospital. So there's many ways to quantify it. When we sell, we pitch at least an X ROI of being able to recover these revenue opportunities that you would not do otherwise.
Wow. And what is your North Star, or what do you think WorkDone can become? And do you have an end goal, or you take it 1 month at a time, or how do you kind of think about the future?
Our overall goal is to build Grammarly for medical documentation. Embedded in the process of creating medical record, most EMR HR systems allow to do that, because in this case, real time means before you create a record. Now, records needs to be created to be audited by our solution. We can potentially move into preventing that. If you create the record and this PHQ-9 score missing, we will tell you before you click on OK. Or once you click on OK, before you approve, we will tell you that these things need to be completed. And this would be essentially enabling an oversight over all medical records at the moment of creation, which is the guidance. It's a differently regulated product. Definitely, it's a different product from user experience, but I think we can get there in years.
Incredible. And last question, you obviously transitioned to the medical world. It seems like you are incredibly knowledgeable already, and it's been under a year. Do you feel like not knowing a domain is a cheat code for you? You think you get more interested in learning new things, or you think it's just the mission behind it that makes it especially interesting for you to learn everything? Or was it a significant roadblock to kind of learn the industry before knowing exactly what to do?
For me, it's a mission. It's apparently too easy built in a space when you are the main expert. That's the best. If someone tells the opposite, don't trust them. But in my specific case, filling in the gap of my knowledge every day, talking to clinicians, talking to physicians in the first place, a lot, those people who work with patients, on why certain problems exist in documentation, what different ways to make their life easier, like creating draft fixes and draft addendums in medical records for them. But still, like I feel we can move even faster if we'll have all the team being in the space building another health tech product, AI scribing tool or something like this. It's not only about the network of customers, it's really about like understanding exactly what's going on. But at the same time, for me, it's a rebirth of learning. Like I spent so much time observing work of doctors over last year. We talked about hospital visits in the first earlier. We do have a maiden medical advisory board with clinicians who represent the biggest healthcare systems. It's not public yet. We're going to slowly spotlight them one by one. Stay tuned. But without those people, that will be much harder. So you need to be able to compensate for any domain knowledge gap by bringing the right people to your team early.
That makes sense. I guess one more question. On the model, the AI side, are you reliant on the big models from the big AI companies? Or are you guys developing as much as you can in-house? Or how are you kind of addressing that technological challenge?
We're building our own model, but we experiment a lot with state-of-the-art models where we are HIPAA compliant. So you cannot just use the same model from the same vendor without the agreement with them. If you can, in this case, you're HIPAA compliant. In this case, we like to have this model in our suite because we can try. We try a lot optimizing things, but for own model, we train it on the feedback loop from clinicians, whether they approve fix or they not approve fix. And this is a big competitive advantage because no one has this data. You can potentially buy medical records anonymized from some top hospital for research purposes. Yes, you will see the mistakes there, but without an active product being used by clinicians where you then run this mistake through a feedback loop, if someone essentially exercises human judgment on what to do with this mistake, you cannot achieve the performance needed to process medical records at scale required to operate in a hospital to improve sepsis or stroke compliance.
So the more it's used, the better it'll get. Incredible. Awesome. Well, I'm rooting for you. What an exciting project to be working on. It seems like absolutely necessary. It's so incredible what this AI revolution is bringing and enabling. So thank you for doing what you're doing. I'm excited to use it when you roll out the consumer side and the end user side. Anything else you wanted to highlight, talked about, throw out there, and how can people reach you?
Not really. Please find me on LinkedIn and let's talk. If you know any doctors or managers in healthcare systems, believe me or not, everybody wins from ability to review all medical records quickly, from any role, from operations to the CEO of the hospital. And please introduce us to more people. It will help us to make the healthcare better, quicker.
Awesome. Thank you so much, Dimitri. Thanks for coming on Peaking.
Thank you. Bye-bye.